Hello and welcome, my name is Chris from ChristopherHole.com and welcome to this video where we're going to be talking about Achilles tendinosis. Now in this video there are going to be a few parts to it. We're going to start with what it is, then we're going to look at some anatomy involved, then we're going to look at some potential causes, and then we're going to look at some potential treatments. But when it comes to treatments, what we have to understand is that this video here is to help educate rather than diagnose or self-diagnose the injury or condition that you think you might have. So please use this as a means of better understanding any potential treatment or any potential diagnosis that you're given, so you're able to navigate that treatment and rehabilitation. So what we're going to start off with is what Achilles tendinosis is. So it's a chronic micro tears to the Achilles tendon by repetitive activity. So what that basically means is you get small little injuries over a long period of time to the Achilles tendon, which is caused by repetitive activity, and we'll come on to what those could be in a second. But basically the anatomy that's involved is we've got the Achilles tendon here, which goes from the calcaneus bone here and then goes into the soleus and the gastrocnemius, which are the two muscles of the lower leg. You've also got other muscles. They won't be directly involved, but if you have an Achilles tendon not functioning properly, then there's a good chance the soleus and the gastroc aren't going to function properly, and therefore there are going to be other muscles that are going to be compensating for that. For example, anterior tibialis, posterior tibialis, peroneus longus, peroneus brevis, so on and so forth. So it's very much down to you as the individual to help orientate either yourself or another therapist who's rehabilitating you, if you will. Because it's your body and you're the one that can give the feedback as to what's happening within your body. So some potential causes of these of Achilles tendinosis. So this is any repetitive activity. It might just be simple overuse. So that means your activity or exercise is out of balance with your recovery. So you're doing too much exercise or activity for the amount of recovery that you're doing. So you need to increase the amount of recovery that you're doing. Could be a sudden increase in training. So you're running 20 miles a week, and then all of a sudden you're running 40 miles a week, or you're training 2 times a week in the gym, and then you suddenly increase it to 4 times. It might be unaccustomed activities. So it might be something as simple as you're a runner, you were running, and then all of a sudden you start playing football that you haven't played for 15 years, or whatever it might be. Then overpronation, which is sort of the inside of your foot collapses, and excessive tension into dorsiflexors, which are your gastrocnemius and your soleus. So there are many different causes. So I guess the first part of your job as the individual is to first understand, well, what could it be, and maybe start removing some of those and sort of condensing down that list of potential causes and bringing it into a slightly shorter list, because part of your treatment is to address the cause. Then it's rice or police, which is your initial treatment. Then you might start thinking about massage and deep frictions, so making sure the Achilles tendon, which again doesn't get a massive blood supply, so these chronic micro tears, so these small injuries, don't get the time and attention from the blood supply to fully heal. So that's what I meant when I said overuse isn't necessarily you do too much exercise, it's the fact that you don't do enough recovery to match the amount of exercise that you're doing. So what you're not giving your Achilles tendon on these micro tears that are on it, the time to heal, so your Achilles tendon is fully functional. So massage and deep frictions can allow that to happen. Resting can allow that to happen because you're increasing that blood supply. Then finally, it's just to strengthen, to stabilize. So yes, you want to strengthen the muscles, but if you know you've got strong muscles, it might just be that you need to stabilize by improving your biomechanics, by improving technique in the amount of exercise that you're doing. So there's a lot that it could be, So it's very much down to you to start figuring out, well, what is it more likely to be and what is it less likely to be? And then start honing down that list and then looking at your new shorter list and honing that down until you get to a sort of a greater probability of it being it is this cause or it could be this cause. So just to quickly overview, first of all, it's small injuries to the Achilles tendon from repetitive activity. It's affecting the Achilles tendon, which will affect the gastrocnemius and the soleus, but also it will affect other muscles of the lower leg. So if you do get any sort of treatment, make sure they don't just treat the Achilles tendon, the gastroc and the soleus, make sure they go all around the leg, possibly down into the foot as well. Potential causes: overuse, which is a balance of exercise and recovery, overpronation, which is improving biomechanics. Treatment would be to first of all address the cause that you think it could be, initial rest, massage deep frictions, strengthen and stabilize. So many thanks for watching. My name is Chris from christopherhall.com. I'll speak to you in a future video.